When I had the opportunity to read the paper on health promotion, I must say I was pleasantly surprised at the fact that prostate cancer support groups seem to be doing it right. In other words, they are able to take health information and discuss it among their members, and be able to do that in an open manner, and that many people get many positive benefits from attending a prostate cancer support group. And again, that is my first impression, that I was very pleasantly surprised that they're doing it. And I thought, okay, so for my work and what I do, I think there's some rich learning for me in what I do in that environment. And I'd be interested to gain more knowledge as to how I might be able to transfer some of that, those findings into my practice and what I do. In thinking about women's attendance at prostate support groups and the fact that it's about 20% from the health promotion paper, I really think an effort to encourage women to attend these groups, a further effort beyond maybe what's being done, should be made, if at all possible, because there's such great benefit to attending the prostate support groups for women to know how to support their partner that is undergoing treatment for prostate cancer or survivorship for prostate cancer. I think women need to hear, or partners need to hear that information sometimes firsthand. And that's not to say that the patient is unable to give them the information, but I think there's value in hearing knowledge firsthand in these environments, and you're hearing the same message. It's not secondhand through your partner or the patient that has prostate cancer. For the same reasons that I like to see women attend my sexual health consults with patients, and that they're getting that information from me, and you're both hearing the same information. But I think it also gives women an opportunity to ask the questions. And then I also think that it'd be important for women to have some sort of knowledge on how they can support. I mean, they're there with their partner at the support group because they want to be supportive. But sometimes I think the question remains, how do I support that person? Okay, I'm here with them, but how do I actually support them? And I think maybe if we addressed those types of issues, then maybe, there may be more attendance, perhaps, like, how do I do that? What does support look like beyond just being present? What I've started to do recently is have group education sessions, in particular for men who are about to have prostate cancer surgery. So they're about to have the radical prostatectomy, and I've offered these group education sessions in the evening. So hopefully that'll catch some of the patients that have partners that are working daytime hours and are unable to attend for various, maybe that reason or for other reasons. And so I have one next week that'll be my third time doing that. But again, it's in an effort to try and increase partner involvement. I know that conversations about erectile dysfunction or the treatments of such are probably quite rare, occurring outside of maybe prostate cancer support groups. But I think when they occur within the environment of a prostate cancer support group, it's legitimized because it is a potential consequence of having prostate cancer and being treated for such. So it's bound to come up, just like urinary incontinence is bound to be a topic that is brought forward in a prostate cancer support group. Again, talking about some of the treatments and some of the sequelae that happens after having treatment. And I think with some of the oral agents that are used with prostate cancer treatment, the fact that they're usually one word is great in that it allows a person to say the treatment options such as Viagra, Levitra, Cialis, and it's able to open up a lot of doors to conversations and experiences, that kind of thing. And I think it makes it easier for men to talk about their concerns or their questions around that topic just by saying, some of the treatment options, right? It's not a big long statement that they have to make or a sentence that they have to make. They can just say the word of the treatment option, and that generates a lot of questions.